Hey everyone, welcome to the Effective Communication Strategies program sponsored by the Alzheimer's Association. As Ms. Jones just mentioned, my name is Jason Hanna. I am an elder law attorney working here in Houston and surrounding counties with Kearney McWilliams and Davis Law Firm with offices in Houston and Denver, San Antonio, Fort Worth. I am a volunteer community educator for the Alzheimer's Association. Just briefly about me so you know who we're talking about or who's talking to you today. Normally I go around the room and everybody introduces themselves, but I was looking at the participant list here and that would take us forever. So we're going to skip that part and just tell you briefly that, I got into this elder law career field about 8 years ago. And, it was the first opportunity afforded to me after law school. I kind of jumped in feet first. And I found myself working with lots of families and lots of clients who were dealing with the recent diagnosis of dementia in the family. And quite frankly, I had no idea what they were dealing with, or I'm trying to advise them, but I'm not understanding what they're going through personally. So I turned to the Alzheimer's Association, and for about 6 months, I was just a ravenous devourer of all information that they had available. And then at about the 6 month mark, I started to feel a little guilty. So I volunteered whenever they were calling for volunteers, and it's my effort to give back, to kind of share what I've learned with the community, and today with you guys. So that being said, we've got some program goals today, some educational goals. Today, we're going to explore how communication takes place when someone has Alzheimer's disease. By the end of today's program, you will be able to explain the communication changes that take place throughout the course of the disease, decode some of the verbal and behavioral messages delivered by someone with dementia, and respond in ways that are helpful to the person. We're also going to try to identify some strategies that are going to help you connect and communicate at each of the 3 stages of the disease. But first, what do you guys think of when you hear the word Alzheimer's? For me, I didn't really know what to think, right? My experiences were limited. I knew Ronald Reagan had dementia. That's about the extent that I knew, right? And late night routine comedy talking about senility and stuff. I was just completely blank as far as what Alzheimer's was. So the short version here is Alzheimer's is a type of dementia, and it's characterized by a loss of cognitive functioning serious enough to interfere with daily functioning. It manifests with changes in memory, language, thought, navigation, behavior, personality, and mood, as well as planning and organization skills. Pretty much all aspects of life eventually become hampered. So I kind of mentioned earlier that dementia is kind of like a broad umbrella term, if you will, with Alzheimer's representing about 3/4 of those dementias. For instance, frontal temporal dementia, vascular dementia, a little lesser known one, alcohol-induced dementia. And then, of course, there's mixed dementia as well, which would be a combination. Say, for instance, someone is diagnosed with both Alzheimer's and Lewy body's dementia. We would call that mixed dementia. So dementia is a loss of memory, of course, due to changes in the brain. Alzheimer's, speaking of changes in the brain too, that's one way to say it. It's kind of a mild way to say it, and perhaps the more crass way to say it is that dementia kills the brain, right? It kills the brain cells. The brain cells that are in the brain that form these webs and connections, connecting memories to bodily functions, to vocabulary. Those brain cells that make those chains within the mind, slowly those brain cells die, and the connecting thoughts also stop. That's how memory is affected. Alzheimer's is the most common form of dementia, as well as we talked about the mixed dementia as well. Some memory disorders are reversible and not truly dementia. For instance, UTIs, urinary tract infections, right? Those will manifest symptoms that are very similar to dementia. There could be some loss of cognitive skills there, but you get a doctor visit and some penicillin, and it's those conditions are reversible. That's not dementia, right? Dementia is not reversible. It is a terminal disease. So what is Alzheimer's disease? You know, we hear a lot of times kind of like the barbershop myths, right, about what the disease is and what various people went through and the experiences my mom had versus what my grandma had. There's a lot of misconceptions about what the disease is. For instance, some folks think that Alzheimer's is only a disease for older people, and that's just not the case. There's a growing group of folks in their 40s and 50s that are suffering from what we refer to as early onset dementia. So while age is the number one risk factor for developing the disease, it's not the end all be all, right? You could be in your 40s and develop this disease. All people with Alzheimer's live in nursing homes. That's one we hear a lot too. And that's just not untrue. The 70% statistic here refers to two things. First, over 70% of those with Alzheimer's are living in the community, right? With a spouse taking care of them, with children taking care of them, adult children, that is. And then the other little interesting statistic on 70% is that 70% of roughly 70% of those nationwide in a nursing home are suffering from some form of cognitive disability that usually affects their mind, right? We're not going to expect a son or a daughter to dispense medication. We're going to expect someone licensed to dispense medication to do that, and you're going to find that in nursing homes. Oops, I went forward one. So everyone gets a little dementia as they age, right? We've heard that one before. And that's not true either, okay? Dementia is not a normal, it doesn't fall in the normal aging process. It is a disease, and simply growing old, yeah, I mean, the older I get, the more and more I realize how often I forget my keys or misplace my wallet. Or forget things, but that's normal. But forgetting the words to use to describe that I have lost my wallet, right? That's dementia. That's not the normal aging process. So we talked a little bit about the brain, about the modern plasticity model of the way that we understand the brain to work. That there is a mass web, if you will, a network of connected neurons in the brain that are forming thoughts with electrical signals passing through the synapses between these individual brain cells. As we talked, the disease kills those brain cells. So it breaks those chains. There are over 100 billion nerve cells or neurons creating this branching network in the mind. And if you can imagine, if the disease starts killing these things, that network is also going to fail. It used to be that the disease could only be diagnosed with an autopsy, right, where you would find those plaques and tangles within the brain. If we look over this little picture for a healthy brain on the left, with compared to a severe Alzheimer's dementia disease brain over on the right, you can kind of see that is the loss of brain matter, of brain tissue that should be there in those plaques, right? Those canals where you see the missing tissue. Nowadays, we do not have to do an autopsy to diagnose, right? There are complete batteries that you can go through, establish a baseline of cognitive ability, go back 6 months, a year later, another test, and it can show if there is a loss of cognitive skill there. And we can rely on doctors to use those kinds of batteries to diagnose the disease versus just throwing our hands up in the air saying, oh, I don't know, we're going to have to wait till they pass away to find out. Signals, let's see, we covered this one pretty good. Yeah, Alzheimer's disease, that's the key point of this slide, is it kills these brain cells. That is effectively how the disease is terminal. As it progresses long enough, eventually the brain will forget how to tell the muscles in the throat to swallow. That's a very common one. Perhaps the brain doesn't tell the heart how to beat, right? This is how the disease is terminal. So we have, generally speaking, 3 stages of the disease. These aren't official. There's no, red line. When this occurs, we're in stage 2. These are kind of a free-flowing as the disease progresses, but there are some commonalities between each one of those stages that is worth exploring, because we can help, because identifying those stages, we can help understand what the individual is going through during that particular stage. But first, let's So first, we have the first stage here. So it's in this first stage, you may or may not see changes in the way the person communicates. For some people, there may be some shifts in their ease with words, or shifts in the way that they hold their conversations. But some of the most common changes you may notice in the early stages are listed in the slide and include difficulty finding the right words, taking longer to speak or respond, withdrawing from conversations altogether, or struggling with decision making and problem solving. And of course, another one we see too is that folks will often react more emotionally than they have in the past, or perhaps just avoiding any discussion whatsoever about the disease or its impact. There is uh, a certain stigmatization here in America in regards to this disease, right? Well, quite frankly, in regards to any kind of mental health issue or health issue in general, to be frank. So there's a lot of times folks that may be facing the reality that they are not what they used to be, may simply say, look, I don't want a diagnosis. I don't want to go to talk to a doctor about this. So whether you notice changes in the way the person speaks or not, communication in this early stage is crucial. This is the period in which everyone involved is adjusting to the diagnosis and is having thoughts and feelings about the changes that are ahead of them. Remember that denial is a part of the disease for some people, while others, emotions can be completely overwhelming so that they just can't talk about things. Coming to terms with the diagnosis and the emotions you are all feeling by talking together and expressing your connection is paramount. This will help you both accept the diagnosis, move forward, and discover new ways to live positive and fulfilling lives together. Communicating throughout the process can also bring closeness that will help everyone adjust more easily to the disease and diagnosis. Um, During the middle stages of the disease, this is usually when you're going to find it's going to be a lot easier to recognize when somebody may be suffering from some of the symptoms of dementia. There will be major gaps in memory. Oftentimes, it's weird how the disease affects everyone differently, but a common trait that I see is I may talk with a client who could tell me all about the summer of 1976, right? That's when she met her husband and so on and so forth, but may not be able to tell me what they did last weekend, right? There are major gaps in memory in the middle stage, and assistance is going to be needed with pretty much all forms of daily activities, cooking meals, perhaps even taking a bath. Certainly, what medications to take and when. That's going to be needed. They Most folks suffering in the middle stage of dementia are unable to recall addresses or phone numbers. So that presents a unique challenge, especially if you've got a senior that wanders, right? Wandering is kind of common, unfortunately, where an individual suffering from the disease may, walk out in the middle of the night, 2 o'clock in the morning, and go for a stroll, still dressed in their pajamas. Certainly not dressed for the conditions or the weather. And you can imagine that situation being even yet more complicated if they can't remember where their address is or who to call to get help when the police inevitably show up on the scene, right? Unable to choose appropriate clothing for the season or occasion, kind of like I was just mentioning with the midnight strolls. Able to eat or use the restroom without assistance is usually pretty tough, right? Most folks in this stage are going to need help with those kinds of activities. Recognizing the names of their children and spouses, that can be hit or miss. Oftentimes, what we see is those folks that are really, really close to the individual with dementia. Those names and faces are often remembered a lot more frequently than perhaps a neighbor or a daughter-in-law or somebody that just doesn't have that long history. Because again, sometimes the long-term memory is in better condition than the short-term memory. Um, so for late stage, there's going to be no doubt, right? It's going to be very difficult for anyone to have a conversation or communicate meaningfully with someone in late stage dementia. One thing to point to is because we divide these out into stages, but the reality is that stage one could be 3 months for someone, stage two be 6 years, and the late stage, a week. Or it could be completely opposite. It could be, 5 months in the early or 5 years in the early stage, followed by 2 years in the middle, and then, the rest of their time with us is in the late stage. Each one of these stages, it's not like a definitive set amount of time, and the disease affects everyone. So you could have someone run through all the way up to stage three really quickly, and you can have someone lingering around in stage two for quite some time. And it's often what we see too is that it's some calamity like a hospital stay, a broken hip that kind of exasperates the situation and can push somebody from stage one to stage two because of that emergency situation. So also in this late stage, you're going to find significant personality changes. I the way I've characterized it sometimes to some of my clients' families is that we kind of see a spectrum there, right? Either grandma is going to be completely 100% hostile to every single thing that you say and do, which is 180 degrees from the way that grandma, has lived her entire life, or she's just going to withdraw into a, completely docile state. It seems to be these extreme opposites. There's like with no middle ground. It's these complete polar changes in personality. They're going to need extensive help with daily activities. Okay. That's everything. That's dressing, that's bathing, waking up, when to go to bed, what to eat, how to eat, the food that you give them, 100% dependent, usually, on the care from others. Um, Most will lose awareness of recent events as well as their current surroundings. Um, uh, Oriented to place and time is often how that is phrased, right? They may not have an orientation to time or place, where they are, when is it? Is it 2021 or are we back in 1980? Occasionally forget names of families and caregivers. Occasionally there is kind of a stretch. We see this pretty common, to forget names of loved ones in the late stage of the disease. Normal sleep-wake patterns are obviously disrupted, and increasing episodes of incontinence are very common. Again, because think of what the disease is doing. It's killing that network of brain cells in your mind that controls the bladder, that controls these bodily functions. Um, Folks also tend to wander or become lost, and this is a tremendous health challenge, presented not only to the families but also to local police officers as well in responding to these situations appropriately. I had one client, she swore by it that this was the solution. And gosh, it worked for her family. And I take the opportunity to encourage it for everyone. If you've got a loved one that is wandering, going out in the backyard or even, down the street when they shouldn't be, one tip is to add a new lock to the door in the front of the house. Yeah, common sense, duh. But no, put it way up high. Okay, because the idea here is that the individual would go to the door, unlock it like they normally would, and wander. Whereas if they would go to the door and unlock it, the disease has such an effect on the mind that they may not consider to look up for another lock at the top of the door, like a switch or just even a clasp lock. So that has tended to be a pretty effective strategy in combating the wandering. And I'm eternally grateful to my client for passing on that tip to me, because I think I've helped a lot of families in passing it, further. Let's see. So role of the caregivers. The, Roughly three family caregivers for every person with dementia in America. Some people might scratch their head and say, no, no way, right? Well, think about the spouse, right? Eventually, if grandma's 75 years old suffering from dementia, grandpa's probably not a spring chicken, right? And he's probably there helping her anyways and doing anything and everything that he possibly can to alleviate the suffering and discomfort that he finds with the spouse. But the reality is, he's probably got a child that's also doing the same thing. And they're probably going to hire a nurse before it's all said and done to come into the house to do the things that a 75-year-old man can't do. For instance, lift his wife up and place her in a bathtub to get clean. Those kinds of things are going to need help. Being a caregiver, I probably don't need to tell anybody in this room this, but it is a very large job, right? You're playing counselor, mediator, cheerleader, pharmacist, nurse, financial planner, personal assistant, chauffeur, chef, and of course, all of our favorites, maid, right? I mean, you are literally doing everything. You may also be the primary breadwinner as well, right? 66% of those that are acting as caregivers call off work due to their responsibilities in caring for their loved ones. 14 just up and quit. I can't work anymore. This is a full-time job, caring for my spouse. While about 13% of those that are acting as caregivers simply just cut back on their hours, drop back down to part-time, for instance. Almost half of those give up all social activities, right? I can't go and meet with my girlfriends for lunch because I can't leave my husband alone, right? Um, 40%, of course, report. I would think that should probably be 100%, but according to the survey here, 40% reported high levels of emotional stress. Now, I don't think roughly, I guess about 300 elder law clients I've had in the past 8 years or so, I can't think of one of them that was not an emotional wreck on the first day I met them, right? They had been dealing with this for a year, for 5 years. They were at wits' ends. Let's be honest. Nobody calls a lawyer when things are going great, right? They call me when things are going bad. So yeah, this disease will stress the entire family out, especially if you have one of those situations where the person suffering from dementia has a complete 180 in the personality. It could be very hard to continue being a caregiver for someone who curses you out on a daily basis or who doesn't know you, right? You can imagine the stress that may present. So, what is communication, right? Communication, of course, is me expressing an idea and someone hearing that idea or receiving that idea in some other form and responding to it, right? That's communication back and forth. Obviously, it's been a long time since I was in my college 101 communications class. I'm sure there's a much more better definition for that. But when we boil it down, that's what it is. I'm conveying a thought, you're receiving a thought, and there's exchange of information. So in the early stages of dementia, conveying thoughts and feelings through language is pretty common, right? You're going to be able to have those conversations. There may be a situation where an individual may not find the right words, where they are taking a little bit longer to communicate their thoughts. But the point is they're communicating their thoughts, right? There's still a free flow exchange of information. They're able to make decisions about future care and may interpret what others say accurately. Now, I can't escape from the lawyer in me, so I have to point this out, right? This is the stage that you need to get legal counsel. Okay, everybody needs a power of attorney, everyone. And if you don't have one, and you wait into the mid stage or late stage, the individual may not have the requisite legal capacity to grant someone power of attorney because they can't communicate about what this contract is for, what it does, how it works. And of course, that's the legal standard before someone can enter into a contract like a power of attorney. The middle stage, communication is going to be a little bit harder, right? Using basic words and sentences is going to be the best way to communicate. I tend to use big words and talk in big long sentences and I just babble is what I do. I can't babble whenever I'm talking to someone with dementia. I have to keep it short and sweet so that they can understand, right? No need for big words, no need for rattle on sentences, just short and to the point. Uh, Folks suffering from dementia in the mid stage also will rely more on the tone of voice. And if you don't believe me, you should believe me, right? The tone of voice conveys so much more than what someone says. And a lot of times, folks that are suffering from dementia pick up on that tone of voice more than they pick up on what you're actually saying. So, if you want to have an effective communication, don't use the tone of voice that I just did, right? Um, but also at the same time, we have to understand our emotions will often play into our tone of voice without us even realizing it, right? When we get frustrated, when we get angry, when we get upset, our tone of voice changes beyond our control. And it's that tone of voice that's going to communicate more. So I guess the tip here, or the strategy tip, is to be cognitive, hyper aware of the tone of your own voice when you're communicating with someone with dementia. It's kind of a no-brainer, but a lot of these things are no-brainers, just worth spending a little bit of time on. For instance, folks in this middle stage will continue to need emotional connection and meaningful relationships, communications with folks. Folks in the late stage, they may still respond to familiar words, phrases, or songs, and they can use body language and the five senses to connect. Now, we're going to talk a little bit more of what we mean about using the five senses to connect. It's a pretty unique strategy, but it is a way to break down those barriers and actually reach the individual that may have extreme difficulty in communicating. And of course, everybody, we're all humans, right? We need that emotional connection. And 95% of that time, that emotional connection is established with communication. So we have some recognizing some of the traits that you may see or physical appearances that you may see in individuals suffering from dementia here. That blank stare, I'm sure we've probably seen it. I don't know how else to describe it, right? That blank stare, slack jaw kind of look, just staring at nothing, confused facial expression, that there may be a problem there, right? Sitting down, put a hand on theirs. Is everything okay? You know, um, things they just may be uncomfortable the way that they're sitting on the couch, right? And they don't know how to communicate that. Hey, can you help me shift around, right? They just that look on the face is them attempting to communicate, if you will. So is the person appropriately dressed for the weather? These are some red flags, right? If it's December and 30 degrees outside and they're in just a 90, that might be a sign that something may be at play here. The person with dementia may have an unbalanced gait or shuffle. Very common that kind of my wife teases me that I kind of waddle when I walk, right? And that waddling, shuffling, slow gait is very common for folks that are suffering from dementia. The person is doing something unsafe is another example that situation. These are actions that should cause us to step forward and say, "Hey, is everything going okay here? Can we help?" Um, Especially if they have no idea of the danger involved in what they're doing. Right? It's just completely oblivious that the example given here is walking on the shoulder of a freeway. Right? That's just not a good idea. But individuals suffering from dementia may not be able to process this is a bad idea. Right? Safety wise. So people with dementia stress out quickly. Um, Limited ability to understand directions and explanations that people are giving them, it's natural that they're going to feel frustrated, right? If you're trying to communicate to me and you're using words that I don't understand and I don't know what that word means, and you sound angry and upset, and you're talking 50 million miles a minute, and I can't get what's in my head out through my mouth, I'm going to be frustrated, right? Any of us would. So just bear that in mind that if they are frustrated or if they are upset, they're most likely not upset with you. They're probably upset at just the situation. The fact that they have dementia perhaps is what has them upset, or most likely is that their difficulty in communicating their needs and their desires to those that they know care for them, that's also going to lead to some extreme frustration. So keep that in mind. And again, lastly, folks with dementia are very prone to wander, and that can be an extremely dangerous situation. So changes that you may notice include difficulty finding the right words. For instance, someone very close to me who ended up getting dementia, she used to use the word thingy-mabob, right? I still to this day, I don't know what a thingy-mabob is, but as the disease progressed, everything became a thingy-mabob, right? It came to a head when she was trying to ask me to do something, and she said, "Put the thingy-mabob by the thingy-mabob." What in the world are you trying to communicate, right? I had to control and settle down, take my own frustrations down a level, and sit down and see what it was that she was trying to communicate. A lot of times you can offer a filler word, right? Folks with dementia will typically, be in the middle of a sentence and then just stop because they can't find that word that they want to use. They know that the word's there, they know what the word means, but it just won't come, and they just draw blank and then just big long pauses. Very often, I do it all the time. And it's sometimes it's not the right thing to do, right? It's to finish someone else's sentence. I know what you're trying to say, and you just get it out there for them so the conversation can move along. Um, I encourage that. It's a good communication strategy, but at the same time, make sure you're not stepping on some people's toes, because some folks will get incredibly irate if you continue to try to finish their sentences, especially if you keep trying to finish it incorrectly, right? And that also can be a hamper or a hindrance on the communication if you just keep guessing wrong. So play it by ear. See how they like to do it. Try it once or twice. If it frustrates them, let them find the word they want to use. And of course, they're going to take longer to speak, longer to respond to you. And it's also very common for folks to withdraw from conversations altogether, right? It's simply too hard to talk about. It's so difficult for me to find the right words. I'm simply not going to say anything. Struggling with decision making and problem solving is also you're most likely going to notice and see those changes as well. So to connect, some good strategies here to form that connection and communication is ask directly how to help them communicate. Right? How can I help you? Would a notepad work? How about every time you want a glass of water, just ring this bell, right? I mean, ask how they want you to help them. And keep sentences straightforward, clear, to the point, not convoluted like I tend to babble on. Leave plenty of time for conversations. That's one of the most damaging things to a conversation is trying to rush through it, because meaning is lost and that connection is lost. And if I'm just trying to rush through everything I got to say, I have no clue if you're actually hearing me or processing what I'm saying, right? So take your time with it. Make sure you have plenty of time to get through the conversation. Include the person in conversations that affect him or her. If I had it my way, I would read that bullet point like 7 times in a row, right? Just to get that point through. Because I can't tell you how many times I sat in a conference room, meeting with 2 daughters and dad who has dementia, and they're sitting there having a conversation with me like dad's not even there, making plans and doing this and what about that. Well, how about we stop and we table that for a second and see what dad wants, right? Please, I beg you, if the individual is there, uh, treat them like they're there, right? Not like that they don't matter or that their opinion doesn't matter. They may be older, they may have a disease, but that doesn't mean that they shouldn't play a role in their own life, especially with decisions that affect their life, right? So keep in mind that we want to avoid making assumptions, right? This comes into play all the time with the moods, right? Where mom's just angry all the time. There's nothing I can do to please her. I do everything, nonstop, caring for her 24/7, but she's always mad at me. Well, is she? Did you ask her? She may be mad that she can't have salt anymore because of her high blood pressure, right? I mean, who knows? But avoid making those assumptions because it only creates a barrier where a barrier would otherwise not exist. And speak directly to the person, talk to them, communicate in a way that is most comfortable for them. Options include phone, email, or in person. This is a big one here with COVID-19, right? Everybody jumped on the Zoom bandwagon. Hey, look at this. We're all on Zoom right now, too. But guess what? My grandma can't figure out Zoom, right? It's beyond her, right? So trying to insist that, hey, we got to talk this weekend and get on Zoom may not be a good idea, especially if grandma doesn't understand what Zoom is or how to work together. And this last one here, I can't stress it enough. Laugh together. Life is too short, guys. We've got to find the enjoyment in life, and laughter has a certain healing effect. It elevates the mood. All those endorphins that run through our brain, happy feelings, right? That those come hand in hand with laughter. Find the time to laugh together, no matter what you do. Please, please. It's an excellent way to communicate, right? You got somebody that's angry and upset, and lead off with a joke that can bring a smile to their face, then everybody's a winner in that situation. So changes you may notice in the later stage here. Increased difficulty finding the right words. Oftentimes you'll get those lulls in the conversation where I was just talking yesterday to Lucy and she said, just wait for it, okay? Unless they don't want you to wait. For instance, if you've got a pattern or a history of talking with them and you fill in the conversations, oh, did Lucy tell you about the mailbox again, right? Or whatever the case may be. You can fill in if they're comfortable for it, but I encourage to just wait, let them. If they're not getting too frustrated by trying to find the right words, let them find the right words. Using familiar words repeatedly is also a good tactic, right? For instance, naming the grandkids. That was very important in our family, right? That grandkids were not forgotten. So their names were used frequently. Stories were often told, just to keep them fresh in the mind. Speaking less frequently, it's okay to sit in quiet silence, right? One of the few things, or one of the first things that my wife said that she loved about me when we met, I said few things at first, right? I think that was a Freudian slip. But one of the first things that she said she loved about me is that we could sit together in a room quiet and didn't feel the need to fill the air and space with words that weren't necessarily needed at the time, to just sit in comfortable silence together. That's okay, right? It's still companionship. It's still being together. It's still sharing time together. And you don't always have to fill that noise with words. Communicating through behavior rather than words more often. You'll see that quite often with folks with dementia. Not only are they talking less, but they're talking by doing things and by showing you things versus using the words to explain it, maybe perhaps because they're having difficulty with those words. So caregivers should consult a doctor when they notice these kinds of major or sudden changes. For instance, let's say that grandma was a-okay, but then she went to the doctor and she's come back and she hasn't said a word since, right? That's a red flag. We need to tell the doctor about that one, right? Common sense, right? So wandering. This takes a slide in and of itself, all by itself, because it is such a grave danger. 60% of people with dementia wander. When you think about that, that is, and the number of dementia cases in the United States, that is a staggering amount of people, millions. Wandering is considered an emergency. We have the Amber Alerts. Those are required for missing persons, right? It has to be, you have to meet the certain hours that the person is gone before they're officially a missing person, before the Amber Alert can go up there. That was the whole idea of the Amber Alert, is let's get past that wait period and put this child's missing identity for everyone to know. Silver alerts are the same thing for senior citizens, right? We see those on the highway all the time. That does not require that the person be missing for 36 hours before we can get a silver alert posted, okay? If they are wandering and they're gone for 30 minutes, you can phone 911 and you can initiate that silver alert process if they are missing. But oftentimes, most folks are found within a half mile of their home, right? They wander down the street. I had a case in Conroe where she was wandering a lot. They found her in the ditch up at Conroe. They've got these large ditches out by the street. She was laying in a ditch in cold water and had been there for an unknown amount of time. She had wandered outside the house and didn't make it far. Most of them don't make it far. Okay, but if you can't find them, don't hesitate. Call 911. If not found within 24 hours, 50% of those people risk serious injury and even death. It is a life or death matter. Call 911. So narrating the search, we talked a little bit about this just now, but look close. 94% of those are found within 1.5 miles of where they disappeared. Landscape troubles, right? Those are going to be the places you want to look, right? Where an individual with a shuffling, slow-moving gait may have difficulty navigating ponds, tree lines, fence lines, brush, wooded areas. You want to look there first, right? Especially if you have some of that kind of landscaping obstacles immediately around your house. Learn the patterns, right? Most of these wandering situations, it's a pattern behavior, right? They used to walk to the end of the cul-de-sac every single day to check the mail. It's just a pattern. It was their daily exercise. They love doing it, and they just don't realize that they moved, right? They're now living with their daughter, and the mailbox is no longer at the end of the cul-de-sac. But that's that pattern learned behavior that they're responding to. So be aware of any of that, these patterns, other repetitive patterns to point to the most likely destination that you're going to find these individuals. Consider areas that the individual's past employment or homes, right? Had an individual one time in a case where they were continually trying to go to the place that they were no longer working, right? And they tell stories about the boss and things that happened at work. They hadn't worked there for 5 years. They didn't know that though. The dominant hand theory that comes into play. Let's see. Silver alerts, and we talked a little bit about that as well. Silver alert can go out even if the person is not driving. Okay, they can be lost on foot. The method of disseminating the alert will be different. There's no road signs. Instead, Twitter alerts, text messages, and emails to the police in the area. That all points bulletin, right? APB that we used to hear about on Dragnet. They'll issue one of those in looking for the person. So wandering, issue an alert to surrounding police departments and/or state police. Encourage the family to contact credit card companies. That might seem a little strange, but the reality is a lot of times folks will use their credit card at a local store, and you could head straight to that store and you can find them around there. So if they've gone missing, pull up the bank statements real quick online and see if there's been any charges and activity on the account. If so, find out where and head on up there. So being approached by a driver, this is more geared actually to the police officers and tips for those first responders in responding to an individual that may have gone missing. Right, they're supposed to identify themselves and explain the situation, not argue with the individual, and try to get their caregivers on the phone immediately. So strategies for emergencies, right? Move to a quiet place, connect to the individual, redirect and use distractions. That's oftentimes individual suffering from dementia might get lost on a tangent trying to communicate something to you. Maybe having difficulty trying to find the words. Um, and it's not like we want to tell them, okay, but right? Just redirect them. Redirecting them is simply hearing what they have to say, but acknowledging it and then moving on to what you need to discuss, right? Which is, um, where is your daughter? Where is your phone? Why are you here? The information that's going to help you get them back to where they need to go. All right, so communicating with individuals with dementia, to connect, we want to approach the person gently. Approach from the front, right? Nobody likes to be startled from behind. Say who you are and identify the person with their name. Use their name as much as possible. Maintain eye contact with them. And if they're in a wheelchair or if they're sitting down in the couch, right? Uh, Common sense, sit down with them, or squat down so that you're on the same eye level with them. Because there's something, when somebody's looking down at you, right? There's like this position of authority, or there's this power dynamic in play when one person is above the other person looking down. We want to avoid that, right? Get on the same level as them. Make eye contact, avoid criticizing or correcting them or arguing them. Those don't go anywhere, right? Join them in their world. It does absolutely no good to tell an individual with dementia that that they did not talk to their spouse this morning because the spouse had been dead for 10 years, right? Of course they didn't. But what good does it to argue with them to convince them that that didn't happen, right? In their mind, it happened. So by us saying, no, it didn't happen, stop saying that, that's not helping anything. It's just creating more tension in the relationship, and it does no good. What good does it do to correct them? Let them have their thoughts. Pay attention to your tone. I kind of stress that again. I won't scream at you guys this time, but pay attention to your tone. It's hard to do. You have to be very cognizant of what you're saying, but most importantly, how you're saying it. And of course, take your time when you're talking to the individual. So we kind of mentioned this earlier, but to connect, join the person's reality. What we mean by that is respect and empathy. Keep them both in your mind. Okay, empathy is perhaps the greatest human emotion out there. If we don't know what that means taking yourself and putting yourself in another person's shoes and understanding or imagining or envisioning the situation through their perspective. It is a tremendous human emotion. It's so hard to practice, but once you have it down, um, controlling your tone and taking your time and communicating with these folks is not going to be the challenge that it used to be, because you're going to understand what they're going through. What would you want in that situation? How would you want to be spoken to if you were in that situation? What information and options would you like if you were in that situation? That's all about empathy, right? Putting yourself in their shoes. We want to assess their needs first, right? We want to make sure that they are a-okay. Let the person know that you hear their concerns, right? A lot of times when we talk, we're not exactly sure that the message got through. Whenever somebody's talking to me and they have dementia, I make it a point to let them know I hear you. I understand that concern. And here's what I propose we do about it, right? Provide brief answers. Don't go off on a long tangent, but provide brief, concise answers that's going to address their needs immediately. Respond to the emotions behind the statement as well. Oftentimes, it's not necessarily what they're saying or what the issue is or the problem or the needs that they're having. It may be more about the emotions behind what they're saying, right? That it's not that they want a glass of water, it's they want you to leave them alone and leave the room and go fetch a glass of water. Just, it may be the emotions that they're suffering through at that particular moment. They just want solitude, right? So, pay attention to the emotions that they're experiencing, as well as what they are also communicating verbally and non-verbally. So to connect, keep it slow and basic. Use short sentences, basic words. Speak slowly and clearly. One person, one question at a time. Limit the distractions and redirect, right? If a distraction occurs, redirect them back to the conversation. I hear you. I understand that the birds are always pecking at the window. I'll see if I can get somebody to take care of it. As we were saying, right, redirect them, get back to it, hear what they say, address it, and then back to the conversation. Be patient, offer yes or fill in words, kind of like we talked about a few times, but stress those two words there, if acceptable. Um, Providing those filler words for some people will absolutely make them irate. I know from firsthand experience. But play it by ear. Find out what they are comfortable with and help them make those decisions. So to connect, we want to give multiple cues, right? Provide visual cues and gestures. Avoid sudden movements. Write things down for the person, right? Notepads, one of those things called sticky notes, right? Use those if need be. It's always nice to refer back to something that's been written down, right? I'm going to call you at 2, or I'll be back to the house here at 2, right? Put a note on the fridge. I will be back at 2. Love you. Repeat as needed. That should probably say repeat, 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 repeat as needed, because it's needed, right? If you're talking with somebody who is having memory problems, you're going to need to repeat yourself. And please don't. It's hard to say, right? Please don't, get frustrated or having to do that. It's hard when we're repeating ourselves numerous times. But when we do get frustrated, and we don't control our emotions and try to keep them in check to further the communication, then those emotions leak into the tone of our voice. And of course, who we're talking to is going to pick up on that. Turn negatives into positives, right? That's a challenge, but it's also a life lesson if you think about it. The little things, try to find that silver lining, right? Yeah, little things may be going bad or wrong, but look about all these good things that are happening, and avoid quizzing. Nobody likes to be quizzed. So what do we mean by that? How are you doing today? Did Joe stop by today? Oh, did Joe call? He didn't call. What about the LARC crew? Did they come by? On and on. That's not a conversation. That's an interrogation, right? Nobody likes that. If you have a few questions, yeah, sure, get them out there. If the person responds, then yeah, it's time to talk and have a have a exchange. But if they're just shutting down and not responding, just peppering them with questions is not going to get them to open up. It's probably going to frustrate them further. All right. So to connect, respond empathetically and reassure. So again, this empathy comes into play, right? We want to join the person's reality. First time I heard that, I was like, what? What does that mean? If they're sitting there telling us about how, deceased Aunt Becky called last night and they were talking about various things. Oh yeah, what'd y'all talk about? She's talking, right? At that point, she's talking to you about Aunt Becky. She may have not been speaking with you at any time before that. So join them in their reality. Have her tell you about Aunt Becky and what y'all talked about. There's no harm in that. And it opens up that possibility for you and the individual to actually talk and exchange ideas, even if they're make believe ideas. Provide reassurance that you hear and understand the individual. That's whenever you're impaired, and you know that you're having difficulty communicating and expressing your thoughts and feelings, it sure would go a long way if someone were to chime in and as you're talking and say, I understand that. I would be upset too. I understand your concern, right? I mean, you're telling them that you hear them and you're validating their concerns. It goes a long way for them to build trust and open up to you further. Focus on the feelings, not the facts, right? They may say something and it may be completely inaccurate, but does that matter? What really matters, I think, is the feelings that led to them saying that, right? Focus on those feelings, not so much on the facts of what happened. No, Aunt Becky didn't call last night, Mom. She's been dead 10 years. That that doesn't really help the conversation if you want to have a conversation, with the individual. So joining them in their reality can be um, an adventurous idea, but it's also a way to connect when you're having trouble connecting. Validating and redirecting the person, if necessary, of course, will always facilitate communication as well. So changes that you may notice in this stage here include communication is reduced to only a few words or sounds. In the late stage, communication is very difficult to maintain. You may get a guttural response in reply. right? Alternate communication is sometimes an idea as well, right? Squeeze my hand for yes, and lift your hand off mine for no. Whatever works. Take your time and relate with them. Possible responses are possible, to familiar words and phrases, right? How you doing today? Everybody can respond to that. I'm doing good. Um, so to some tips here to connect, if these are kind of the changes that are happening in this later stage, is listen for expressions of pain uh, first and foremost, and respond promptly. That's the key thing. We want to make sure that they are comfortable. So if they are telling you that they're in pain or that they hurt, pay attention to that. Help the person feel safe and happy. Continue to bring respect to each conversation. We do that with our tone of voice and the word choices that we make. And sometimes that the absolute silence is not comfortable silence, right? If you want to keep talking and they appear like they're listening, feel free. Or if you want to just do what you can to get them to keep talking, if they can, right? And then, of course, this last one here is to use all five senses to communicate. So, what do we mean by that? Because that is kind of strange too, right? So, we can connect with an individual with advanced, or sometimes they're called early, mid, and advanced stage dementia, or stage one, two, three, or early, mid, late. Anyways, the late stage, we can connect with individuals with touch. Some of these examples include feeling different fabrics and identifying shapes and hand lotion massages or identifying everyday items, in a bag, right? Like this is a bottle, this is a can. Visiting with animals, petting and touching animals, sculpting clay with your hands, right? Or just holding the person's hand and stroking his or their arm or your shoulder. This touch will open up communication, right? Whether it's a conversation about how the fabric feels, or the felt reminds grandma of when she used to do needlepoint, or whatever the case may be. It's this extra sense that we're using that can spur a conversation. And in that same line, sight, another one of our senses, ways that we can trigger communications and interactions regarding the sight would be to use brightly colored laminated pictures, right? That might unusual images in colors that might spark a little bit more of a reaction than we would otherwise see from someone in a late stage dementia. Watching videos of animals, travel, or nature. This was big in our family, right? The funny animal videos. It was also a way to laugh together, and we talked about the healing power of laughter as well. Looking at old photo albums together, taking that trip down memory lane, right? Connecting through the use of sight, viewing photos of famous painters. I had a client one time that I'll save this one for connecting through through sound. Bird watching, aquarium visits, the aquarium downtown. While it is tremendously busy, it is also very see, I'm lost for a word myself. It can spark a lot of reaction in individuals. And of course, just going outdoors and enjoying the weather. Connecting through sounds. Yeah, this is a little story. I was a little tangent I was going to give you. I had a client one time that they were in a nursing home. They were advanced stage dementia. They could not communicate for the most part. But if you sat her in front of a piano, get your wallet out and start looking for the tip jar, because wow, I mean, just you play just any, just these songs were just in her mind. They were stuck there. They weren't going anywhere. And then when the most tremendous part about it is after she would play 5-10 minutes afterwards, she was a different person, right? It's that sound bringing back the feelings, the emotions, the thoughts, that allowed her to open up and connect a little bit after she played. It was really tremendous to watch. Phenomenal pianist. But listening to sounds of nature or farms or cities is also a good tactic as well. For instance, if you've got a loved one that grew lived his whole life on a farm and was always around animals and cows and goats and whatever the kinds of things they keep on a farm. I'm a city boy here, but playing recordings of those farm and nature sounds might be a good way to light a spark that would create some interaction between someone and another individual with late stage dementia. Listening to songs or speeches in the person's native language also has a tremendous effect, right? I always ask this question to my bilingual friends, what language do you think in? And I think the most common answer I get is both, which as a, someone who only speaks English, and that's just phenomenal, right? But if you live your first 20 years, for instance, of your life speaking only Spanish, and then, another 60 years speaking English, going back to that Spanish can trigger some reactions in an individual that we otherwise might not see. Reading books together, poetry, scripture, newspaper articles, reading to them. When I was a kid, my mom used to read to me as a little kid, right? And the roles are kind of reversed now. Let the person hear the gentle tone of your voice. That love and that care and concern that you have for them, all of that's going to play out in the tone of your voice. Again, probably subconsciously. We can also connect through smell with folks with late stage dementia, right? We can make these little small plastic bags containing like herbs and spices from the kitchen, maybe even cotton balls dipped in some essential oils, or, even like grass clippings, right? Or flowers. Tea, coffee beans, different ground coffees have lots of different flavors. And again, it's the idea of triggering a response and in exchange based on stimulating these other senses, right? The smell of cooking food, for instance. Oh man, bacon cooking will straight up pull me out of the bed by force, right? So you can imagine if I'm lost in my own world, sitting on the couch, not really wanting to talk to anybody, suffering from late stage dementia, that smell of that food cooking could wake me up, right? It could get a little interplay between me and my loved ones. So connecting through taste, yet another of our senses. Favorite foods is always a good idea. Home baked goodies, if possible. A lot of seniors are suffering from other complications such as diabetes and such. So we don't want to throw 50 million cupcakes at them if that's the situation. But if it's okay for the diet, man, those sweets have a way of waking folks up sometimes. Those old popsicles that you had as a kid, right? Flavored drinks, even ice cream. I had a client one time, she was in her 90s, and the family had told me that the only thing that she ever ate all day, any day, was Bluebell ice cream. She had a breakfast, lunch, and dinner. And they said, and it's kind of where I learned this idea really of, why fight it? She's a grown woman. She's 90 years old. She's free to do what she wants. It may not be the best health decision, but it also means that she's eating, right? So I don't know, just kind of a crazy story there. Next slide. So communication throughout all phases of the disease here, we want to join the person's reality to connect. That's where you're going to find those meaningful interactions. We want to understand.
Jason, real quick, we're going to have to wrap up in a couple of minutes. You're actually over by a little bit. We're hoping to get into the conversation circles at 11:15, but no worries. We just want to let you know just a couple more minutes to hopefully wrap up.
Okay, thank you. We'll cut the slide off short. You guys, folks have probably read it there. Yeah, kind of all these things that we've talked about, just keep them in mind in your head in talking to individuals with dementia, and you're going to have a much more meaningful and positive exchange with them. Just this last quote here: between stimulus and space, between stimulus and response, there's that space. And it's in that space between when somebody says something to me and I reply, it's that space that I get to choose my response. In our responses lies our freedom and our growth. It's a tremendous quote by Mr. Frankel. Lastly, this presentation was presented by the Alzheimer's Association. So this is, of course, our call to help, right? If you want to get involved, if you want to participate in the Alzheimer's Walk, if you want to do the any of our fundraising activities, or if you just want to call and talk to somebody, that 1-800 number there, please write it down. If you're suffering from any kind of emotional distraught, if you need legal help, if you just have questions, if you just want to talk to somebody, please call that 1-800 number. It's 24/7. A person will always answer that phone. And they can, if they can't help you directly, they can direct you to somebody who can. For instance, some of these support groups that we run here in the local area, our education programs such as this one, and of course online, there is a ton of information available to you guys free of charge. It's there for the reading. And I do thank you for allowing me to speak here today on behalf of the Alzheimer's Association.
Thanks so much, Jason.